Hi, I am Dr. Leela Mohan PVR. I had done my MBBS MD. I'm general medicine physician. I practice at Motherhood and Rainbow Hospital, Sajapur Road. I have my own center called as Padithem Healthcare, that is in HSR layout, Bangalore. Hepatitis B does not get transmitted by the casual contact. The normal myth is the virus. Example, if you take COVID, when a person coughs in front of you, the virus will get transmitted to you. So with the hepatitis B, it is not the question. So hepatitis B virus will not be transmitted by the casual contact or like kissing or hugging, using the same utensils or having the meals with the same person or sleeping with the same person. It doesn't get transmitted. Mainly it gets transmitted by the exchange of the blood or semen or vaginal secretions, the other body fluid transmission. The common modes of hepatitis B transmission include unprotected sexual contact. If you are participating in a sexual intercourse with multiple partners, we should definitely use the protective measures. Otherwise, there are more chances of the virus get transmitted from person to person through unprotected sexual intercourse because of the vaginal tears or any abrasions on the mucosa of the vagina or certain things. And there is one more way it gets transmitted by using the infected needles. Some of the people get affected by the hepatitis B because of the using the same needles. Like if any people who are consuming the drugs, all those things without knowing, they use the same needles and they inject themselves. So that is how easily the virus can be transmitted. There is one more transmission which is mainly from the mother to the child. Definitely it is not by the genes. During the delivery, because of the infected mother's blood and the baby which comes out from the mother's womb, that contains the fluid which is rich in hepatitis B virus, and that is the main reason where the baby also will be affected easily. This route is very common where the virus prevalence is more. The infected mother will definitely pass the virus to the born babies. The other way easily it spreads by accidental needle sticks. Who are healthcare workers like the nurses who are working in the hospitals, compounders or sweepers, or sometimes doctors, surgeons, who all are under medical care or healthcare providers should be very cautious because unknowingly they get stick with the infected needles. So that is how the virus can spread very easily among the healthcare workers. The virus usually does not spread by hugging or kissing on cheeks or touching a person. As I said, sleeping with the people and having same meals from the same plates, it doesn't get transmitted because the quality or the quantity of the virus will not be sufficient to get transmitted through the saliva and the body fluids from one person to other person. So the myth too is there is no treatment for the hepatitis B. Definitely there is no treatment, a proper treatment for the hepatitis B. Only thing is we have to control the virus transmission mainly. While definitely the chronic hepatitis B will not be cured completely. Only thing is if we'll take care, we will not develop the liver cancer or the liver infections. We have to maintain the healthiness of the liver, getting consultations with the general physicians or your doctors will definitely help you in getting treated with the chronic hepatitis B. There is no permanent treatment which we have to remember, so it is like a prevention is better than a cure. It has to be kept in mind. There are certain antiviral drugs such as tenofovir and all. We use it very regularly. This mainly interrupts the transmission of the virus and helps not in progression of the disease. So these medications has to be taken in a long term, and regular follow-ups with your doctor also helps. Getting done tests like liver function test, what we'll call it as LFT. There are many things which involved in that: total bilirubin, indirect bilirubin, SGOT, SGPT. There are certain levels which will be estimated in your blood. Along with that, we have to get it checked, the viral load, like how much is the quantity of the virus present in your body, and we do a test called as ultrasound abdomen and pelvis, that is a normal USG scan. Even that also helps to check your liver healthiness, which has to be monitored very regularly if you'd have been affected with hepatitis B. So the other way to prolong it or to prevent it, lifestyle modifications, definitely absenteeism from the alcohol also helps in keep the liver healthy. So we should not consume alcohol. If you have a habit of consuming alcohol, definitely you should leave it to live longer. That is the main principle. And then regular physical activity like exercise and reducing your stress levels, having a good sleep habits, and leaving certain bad habits like consuming drugs or smoking. Certain things also help you in prolonging the phase of the hepatitis B. So the other thing is vaccination. Vaccination definitely helps you in preventing from getting the hepatitis B. But if a person is already got affected with the hepatitis B, definitely the vaccination will not help in this case. But still we can take the vaccination. So myth 3 is will the hepatitis will be transferred from parents to child? Definitely it won't get transmitted by the genetical predisposition or anything like you have in your DNA or RNA. I have the genetic problems which my mother is having virus, so I would have got it like that, I'll get it like that. It is not like that. Only it can happen during the childbirth, when the mother is giving birth to the baby or newborn fetus. There is most probable chances of transmitting the virus from the mother to the child, and so this process of transmitting is called as vertical transmission. So the vertical transmission is nothing but transmitting the hepatitis B virus from the mother to the child, and we can definitely prevent getting affected of the newborn. We give hepatitis B vaccination. Along with that, we give HBIG, that is hepatitis B immunoglobulin, within 12 hours of the newborn. If it will get administered, then there won't be any chances of the progression of the disease in the newborn, which is a very effective measure. Usually we treat the newborn babies who are affected with the hepatitis B are treated like this. So by knowing these all facts, we know now how it gets transmitted and what are the types of transmission and what are the probable methods of treatment. So now we all are aware. On this World Hepatitis Day, we will fight against the virus. We will get vaccinated ourselves and tested very regularly, and following the safe sexual intercourse patterns. All these helps us in awareness of hepatitis B, and will spread this message to each and everyone on this World Hepatitis Day.